It's a growing trend. More women are choosing to have breast augmentation followed by liposuction. Now, a new procedure promises the results of both. And Dr. Bill Johnson of Innovations Medical is here to tell us all about it. Hi, Bill. We've talked about this type of augmentation before, but this is mirroring these two procedures together. How does it work?
We really are mirroring the two procedures because what we're doing is we're taking liposuction and we change it a little bit. We use a little bit different tools and we actually call it harvesting.
Okay.
So we harvest the fat so that we can use it, and we then process it to remove the fluid and get it ready, and we take it and use special tools to inject it back into the breast and give a breast augmentation.
Wow, this seems like the best of both worlds. I'm sure there's advantages and disadvantages, so let's go over those.
Yeah, the advantage of natural breast augmentation is that we're using your own fat.
Yeah.
So it's you. It's not a implant. It's not a foreign body.
Substance, yeah.
Okay, so that's one.
Okay.
Two, most breast tissue is fat. That's what's normal for that area. And so when we put fat in to enhance the shape or to enlarge it, it looks and feels very natural. And we've got Biz up right now, who is our New Beginnings winner, and you can see her in her referee jersey before and then after. Here in the last.
That's not your typical augmentation, and she was obviously a really good candidate for this.
She was a good candidate, and we did that in the office, and this is Liz Sett, who's our other New Beginnings winner, and she's in her her FedEx delivery shirt there, and we can see a before and after as well.
Okay, so how does this natural augmentation work?
Well, we take the tissue, the fat, and we inject into the breast, and nowadays using modern techniques about 50 to 70% of the fat survives, and then we're now adding platelet-rich plasma, which is rich in growth factors that enhance the survival, and estimates are that we can get about 90% survival on the fat cells, and that's long-term.
Why are those two candidates like we just saw? Why were they good candidates? Who would be someone who should maybe seek this as an option?
That's a great question, Amy, and people that are in the middle of extremes on breasts are really good options.
Okay.
People that are really small, the fat itself has no shape.
Okay.
And we're limited in what we can do by the shape of the skin.
Okay.
So very small women or women that are very, very large and drooping aren't good candidates.
Okay.
But those in the middle, those that are, say, a large A cup, through a double D cup are very good. Women that have had pregnancy and had their dress fall or droop after pregnancy are a very good candidate.
Okay, good to know.
Women that have lost weight and now have some drooping or just some drooping with age, very good candidates.
And this is probably a safer option, would you say, when it comes to, obviously we know the results are going to be great.
It has some good features about it in that it doesn't have any of the problems with hardening or capsule formation that breast implants can have. One of the concerns historically has been that the fat would interfere with mammograms. Today's modern mammography, that's really not an issue. We can rarely get some calcium formation from injecting fat into the breast, but it's no problem with modern mammography techniques to tell calcium from fat versus calcium that is of concern. Okay,
good to know. Now we want to find out more information, so we go in for that consultation, and you're offering a special for GMT viewers right now.
We do have a special. We're offering 25% off on the Fat Transfer with platelet-rich plasma. And we're also offering $500 off all liposuction procedures between now and the end of July.
Okay, so we are still in time to get in shape for that bikini this summer.
Got 10 days left.
Okay, Dr. Bill Johnson, thanks so much. And log on to innovationsmedical.com or give them a call. It's 972-331-8844 for that consultation. And if you have a question for Dr. Bill Johnson, just drop him an email at questions@innovationsmedical.com. We'll send it over to you.